going to take you through a case that I recently dealt with of abomasal bloat in a lamb. Now, as you'll see in the video, it's level 4 lockdown here at the moment, so I don't have any spare hands to record while examining and treating the lamb, so we're just going to do what we can here. So abomasal bloat, just really quickly, bacteria eating the lactose in milk and producing a ton of gas with it inside the lamb's little tummy. This lamb is in the process of weaning and has, just in the last couple of days, has dropped a feed in exchange for increasing the volume of the other two. This is a really high risk time where we see a lot of abomasal bloat cases, as well as other types of bloat around weaning as well. In this case, she has been absolutely fine up until this morning. Now she is blown up within about an hour of the milk feed. She has, as you can see, a rocking horse stance, which means back legs out, waddling, so that she can make it a little bit easier for herself to breathe. And she has a big, round, tight abdomen. Now, the first thing that I do here, and I'm just going to take you through sort of my decision-making process. The first thing I do here is I put the ultrasound probe on that abdomen to make sure that we are dealing with a true abomasal bloat. To get an accurate diagnosis, bloat causes in lambs are often very misdiagnosed. There are many different causes, so what I do is I ultrasound. So indeed, this presentation with this lamb is very classic of a simple abomasal bloat, but I can never be too sure, and I'm very passionate about these cases being diagnosed and treated correctly. It takes me 2 seconds with the ultrasound probe to see that we are looking at very normal intestines, normal stomach chambers, except for the abomasum, which is large, predominantly filled with gas, with some milk fluid sloshing around, because go figure, she had her last milk feed, and then as soon as that abomasum blows up, it's no longer emptying, so her last milk feed is still sloshing around in there. Now, next thing I do is sometimes I'll pass a stomach tube in the hopes of relieving some gas. Now, it's actually really unlikely that this will work well, just because that tube is usually going to head straight on down into the grown-up chamber of the stomach called the rumen and bypass our big gas-filled abomasum anyway. In this case, I got a very small amount of gas back from the rumen as expected. And then when I removed the tube, you can see green gunk in it. I started washing the tube out before I thought, oh, I should video that. So that green gunk coming back, that's fermenting grass. So that tells me that yes, indeed, that tube went straight down into the rumen, which is not surprising. So it didn't help us out at all in this case, but there you go, there's no harm in trying. So my decision here is, do I need to trocha this lamb after applying a numbing local anaesthetic into the abomasum to relieve the gas? This is a high risk procedure to do in my experience. So with these risks in mind, I do reserve trochaing for the very severe cases that need to be able to breathe right now or she's going to die. This lamb is not in that state, so with her I'm opting for a medical treatment. So they would really need to be open mouth breathing wide and struggling for air for me personally to do that. Other vets may feel differently about that. We've all just got our own experiences. So I will be giving this girl a medical treatment. So I'm giving her a combination of drugs that are going to stimulate her abomasum to contract and empty while opening up those sphincters throughout the gastrointestinal tract to release the gas out the back end. So basically, she's going to fart a lot on the car ride home. She's going home with another dose for the owner to give a little later tonight as well, and she's also getting a course of antibiotics to wipe out that nasty bacterial infection. Some anti-inflammatory pain relief, which aside from the pain relief will take down inflammation of the stomach as well. An inflamed stomach can go floppy and stop contracting, so that's really important as part of her treatment. She's going home with a quality probiotic to repopulate the bacterial flora in her tummy after the antibiotic course has finished as well. And I'm also giving her a dose of Bicarb. So that's baking soda, that's just a standard baking soda. This is not a treatment for bloat, baking soda. It is not going to resolve a case of bloat. What it does do is it acts as a buffer for that stomach lining to protect it from ulceration, which is what a lot of these nasty bacteria cause with the inflammation that they cause. So that inflammation and ulceration of the stomach lining makes them feel sick, less likely to drink, and eventually bursts right through the wall of the stomach, putting the animal into shock and death. So this is not a treatment for bloat as such, it's a supportive measure. And then the key here, guys, and if this is the only thing that you take away, is that she is never allowed another milk feed again, okay? We know that she's got a large population of gas-producing bacteria inside her abomasum. She is going to go straight onto Yogatised milk, which is essentially a lactose-free diet. So there is no food for those lactose-eating gas-producing bacteria to thrive on. Does that make sense? Now, her first batch of yogurt would usually sit aside for 24 hours. We're going to pull just her first batch forward to 12 hours just because we don't want her starving between now and then. She is still a baby at the end of the day. She needs that constant source of sugar, but she can manage 12 hours drinking only electrolytes until her first batch of yogurt is ready. She's also, you know, at about 6-7 weeks old now, so she's doing well nibbling bits of grass, and electrolytes do have some sugar in there as well. So that'll keep her going just for 12 hours, and then we'll start getting that yogurt into her. If you want to know how to yogurtize milk, check out this episode here. If it's not linked above my finger, it means it's coming up in the next few days, so just subscribe to catch that. Electrolytes are also part of the treatment plan, not just to tide her over till her yogurt's ready, but because hydration is crucial to regain healthy contractions of that gastrointestinal tract. Right, so she's off home. She's been given a disclaimer that if she gets worse, she will need a revisit urgently to relieve that gas with a needle. But spoiler alert, she was absolutely fine. She relieved a lot of gas on the car ride home. She took her electrolyte dinner, and by 9 a.m. the next morning, she was on yogurt feeds, happy as Larry. All right, guys, I'm going to leave it there. I know that these things are not necessarily all things you can do at home. Some of them are, some are not, but I just wanted to show the complexity of the disease and the decision-making process as I work through it. Okay, guys, I will see you for the next one. Don't forget to subscribe, thumbs up, and comment away to let me know you enjoyed it. See you later.